We've created a fund called Green Links, which gives access to cheap capital to our triple net tenants. Essentially, they can access capital from us, put it to work for things that benefit the environment, and they don't have to pay us back until they actually see the return.
I'm here today with Rick Matros, Chairman and CEO of Sabra Healthcare REIT. What are some of the ways that Sabra looks to diversify its portfolio within the healthcare sector?
So the most recent sort of evolution in terms of diversification is with the behavioral space, addiction treatment. So we were the first REIT in it about 5+ years ago, and today it's 13 to 14% of our NOI.
How does Sabra partner with its operators and tenants to provide better environmental stewardship in your properties, and why is that important?
So ESG is very important to us, and so we've done a couple of things. About 80% of our portfolio is triple net, so you've got challenges there in terms of how much sort of clout we actually have. And so we've done a number of things. One, we've created a fund called Green Links, which gives access to cheap capital to our triple net tenants. Essentially, they can access capital from us, put it to work for things that benefit the environment, and they don't have to pay us back until they actually see the returns. So that's a relatively new program, but we're getting really good response to it. With our managed portfolio on the senior housing side, it's a little bit different because we can work more directly and collaboratively with them. But we're sharing some of the best practices with the managed portfolio with our triple net portfolio so they can see the advantages. So we're kind of working it from a number of different angles. And then we have our operator conference coming up in a couple of weeks. And a lot of the focus in the operator conference is going to be on tech and ESG and things like that.
How would you describe the performance of the healthcare real estate sector at mid-year?
I guess it depends on which asset class you're looking at. I think for senior housing, there's some tailwinds there. I think on skilled nursing, I think the overhang of the staffing mandate, that needs to get resolved. We think there'll be actually some positives there in terms of how the industry can work through that. But I think that needs to happen. And then generally speaking, on the skilled nursing side, I think the investment community needs to see just more progress generally. And I think as we get better than average Medicaid rates this summer, the market basket in the fall, and continue to see occupancy improvement, I think that'll come.